The CDC's Advisory Committee on Immunization Practices, newly handpicked by Health Secretary Robert F. Kennedy Jr., voted today to end its universal COVID-19 vaccine recommendation, advising instead that shots be taken based on, quote, individual decision-making. Mark Strassmann joins us now from Atlanta to break this all down for us. And Mark, walk us through exactly what the panel voted to change today in regards to the COVID-19 vaccine.
Hey, Nicole, good to talk to you. The COVID-19 vaccine was the topic of the day before this committee. There were two key votes. The first one was whether the committee would recommend that states recommend that a COVID-19, somebody who is seeking a COVID-19 shot would have to get a prescription first before getting that shot. There was a lot of discussion about limiting access and pushback from pharmacy groups, but in the end, the board shot down that vote. It was a 7-6 vote, very close, but no change. So in other words, the proposed alteration that the patient get a prescription first was a no-go. The second vote had to do with whether to recommend that somebody seeking a COVID-19 shot of any age would first have an informed conversation with their doctor about the risks and rewards. That passed unanimously. Both proposals now both votes go before acting CDC Director Jim O'Neill. And the bottom line is this: people who want access to a COVID-19 shot from a practical standpoint should still be able to get it just as they always have. Whether this conversation, these votes, sow more confusion is another matter.
Yeah, also, we saw the CDC panel delayed the hepatitis B vaccine vote indefinitely and reversed itself on a vote regarding MMRV vaccine funding. Those are two things that hadn't previously occurred with a panel before. The head of the panel even said today we're rookies. I mean, what was the atmosphere like at the meeting and the vote?
There was a lot of, keep in mind, Nicole, that all these folks are brand new to this panel. And they are not used to dealing with each other, talking to each other. There was confusion, there was hesitation, there were allegations at one point that the chairman had muted somebody's microphone. So it was it was not the smoothest, at times the most professional conversation of a committee like this that anyone's ever heard. But remember, too, these were all handpicked by HHS Secretary Robert F. Kennedy Jr. I think to some degree there will be relief that the recommended prescription was shot down. And in the eyes of some people, too, that could be a little bit of a surprise, given the fact that Secretary Kennedy is a vocal vaccine skeptic.
All right, Mark Strassmann reporting from Atlanta tonight. Thank you so much. We are joined now by Dr. Georges Benjamin. He is the executive director of the American Public Health Association. Thanks so much for being with us. And, what do you make of the decisions by this panel over this two-day period? Yeah,
this has been a very chaotic meeting, but, I guess we got the best we could get. In essence, everybody can get access to the vaccine now. But, the way they did it in such a way, imagine being the Federal Reserve and saying, we're going to lower interest rates, but anybody wants to do it can do it. And that's in essence what they said. But the good news is we can get it. And now the department has to sign off in a specific way to make sure that all the insurers will pay for it under the law.
And do you expect that to happen?
I certainly hope they do it that way.
If they don't,
it'll be more chaos.
Understood. I want to drill down a little bit more with respect to the decision about the COVID vaccine, this notion of making it an individually based decision. Do you think that will deter individuals in any way from continuing to get the COVID shot if they were already doing it, or vice versa?
This whole meeting has been about making decisions that we already have. It's already an individual choice. No one's making you go get a shot. In most cases, maybe if you're a health provider, you need to do it for your work. But in general, no. It's always been pretty much an individual choice.
So it doesn't change anything in your view?
It doesn't change anything.
This panel also, as you kind of referenced, seemed to be unfamiliar with some of the protocol, and there seemed to be some disagreements over the course of this meeting. Given that they're making these important medical decisions, how concerning is that to you?
Very concerning to me. This is a regulatory body who is making important scientific decisions, but for a regulatory purpose. And so I hope that they will spend a lot more time in subcommittee having the debates. A lot of the stuff that happened in the committee of the whole should have happened in the work groups. They should have brought in more of the private sector groups that they have disenfranchised into the conversation, work that stuff out, work out the language, have your lawyers involved, not to control things, but to make sure you understand what's going on. And then putting those up for a vote, and those things will be much more smooth.
And what do you tell a parent who may be confused about some of these changes?
I would tell them that this committee has just said that you're eligible for the vaccine, and hopefully your insurer will pay for it, and we'll find out very shortly whether that's true.
And more specifically, with respect to the hepatitis B vaccine and delaying a vote on this. So that means, obviously, newborns can still get this shot. But why is this a controversial issue?
It's an ideological thing. Waiting 1 month after birth to give this shot was a ridiculous conversation. The reason we do this is because we know the vaccine is safe and effective. And if you get someone when they're at the point of care, which is at the point of delivery, you're much more likely to get them vaccinated. If you ask them to come back a month later, not going to happen.
And so when do we expect this panel to meet again? And do we expect any other recommendations could be coming down the pike?
They usually meet about 3 times a year, so unless they have a special meeting. So hopefully a few months from now.
Okay. Well, to be continued.
Thank you.
All right, Dr. Georges Benjamin, thank you so much.